Well, good evening, and thank you for the opportunity of being here and sharing with you this part of the panel, which I have entitled Driving and Dementia, 3 Lessons Past, Present, and Future. So I want to start by thanking all of you for choosing to spend this wintry night with us talking about a topic that, as both Phyllis and Joan have addressed, is a topic that is important and meaningful for all of us. But it's also a difficult topic. It's a difficult topic to address. It's a difficult topic for individuals living with dementia, for those of us who are loved ones or caregivers, and then for healthcare professionals as well, and especially for those who have a mandate to report. So thank you for choosing to being here, and thank you to the Alzheimer's Society and McCormick Services for creating this space, for not shying away from hard topics, but creating spaces in which we can all come together collectively and think of strategies that we can implement to support those in our communities that are living with dementia so that they can live well with dementia. I also want to thank Dr. Jan Polger, who's a professor in the School of OT, and she fortunately sort of channeled this invitation to me because she knows this is a topic that I'm very passionate about and that is actually the basis of my research program. And then I also wanted to tell you and thank all the researchers and clinicians that have dedicated their life's work to enhancing the body of knowledge around driving rehabilitation. It has taken a lot of resources, a lot of time for us to be able to understand better what driving with dementia looks like and how can we support people that are living with dementia. So I thought it was very fitting that because we're talking about driving, that we should have a roadmap. So this is the roadmap of what I want to share with you today. So first are 3 things we know from the past. So what has the research taught us in this past few years? And I want to share with you some of the insights that we've learned in regards to driving and dementia. Then 3 things we need, and my hope here is that I'll be able to provide some practical resources. So things that you can do if you're living with dementia or your loved one is. So what are some resources that are available to identify risk early, to have positive conversations around these topics? And then 3 things to look forward to. So I also want to leave you inspired and hopeful that there's a lot of research out there that is looking at new things and innovations and supports. So I was hoping we could close with 3 things that the future holds for us in regards to driving and dementia. So let's talk first about the 3 things that we have learned. The first one is that driving is a vital component of social participation in our societies. And I just want to ask you, for those of you who are here, and then those of you who are watching us online can also think about this, but by a show of hands, how many of you have a driving license? Yeah, that's nearly 100%. And I don't think that is just a coincidence. It really is a reflection of how much we need driving for different things. So let me show you this. In a recent survey that was actually published last year that surveyed more than 3,500 people, over 55% of them said that they were planning to drive beyond the age of 80. So that is the general population. And I think that really shows how important driving is to us, all the things that it enables us to do. So the other thing that the research has shown to us is that driving cessation, so stopping driving, has often been linked to depression, to overall health declines, and to earlier admissions to long-term care. And that doesn't necessarily have to do with driving cessation itself, but with the way that we are enacting that as a society, the way that as a community we're providing supports or failing to provide adequate supports. And then finally, the driving provides us with the opportunity to do other things. As occupational therapists, I often tell my students, driving is the occupation that enables other occupations. So you get to go visit your loved ones or volunteer or work or engage in the things that are meaningful to you. And that's why driving is so important. The second thing that research has taught us is that dementia negatively impacts driving performance. And Phyllis showed this, but let me show you what we know now. We know that people living with dementia have a 4-fold increase in the risk of collisions for every 1,000 miles that are driven per week. So we know now that there is an increased risk for collisions. We also know that individuals living with dementia are more likely to fail an on-road assessment when compared to older adults that are matched in age and that do not have the diagnosis. And then finally, that they also make what we call more driving errors, which is executing maneuvers when driving that are not appropriate or safe. But we have also learned from the research that a diagnosis of dementia does not mean that a person must stop driving immediately. And in this month of awareness, it is really important that we also fight that stigma too. A diagnosis doesn't mean driving cessation immediately. It means supports, adequate resources, it means important conversations, it means a network of healthcare professionals that are there to help, and it just means preparing, but it does not necessarily mean that the person needs to hand on their keys, and the research has supported that consistently. So let me show you in regards to that what we know. Many persons with mild dementia may safely continue to drive over several years, and that has been consistently reported. But even in the general population, increase of people with dementia, increased severity predicts shorter times. So obviously, the more severe the dementia is, the shorter time it will be until that person decides or needs to or is required to hand over their keys. And eventually, we do know that individuals with dementia will need to transition away from driving. So that is something that we do expect as the cognitive continuum, as they navigate the cognitive continuum, but it does not need to happen immediately. So then, in light of that, and in light of everything we've shared, what do we do? So what now? What resources are available? So here is where I'm hoping to give you just very practical resources. So the first thing we need to do early identification. How do we know if we're at risk? Is it just paranoia? Am I actually having any difficulties? So let me share with you 3 resources that are available. The first one is the Fitness to Drive screening measure. It's an online, completely free tool that it's designed to be completed by a caregiver or a loved one that has driven with the person in the last 3 months. It has a Canadian version. It was developed by Dr. Charlene Klassen and her colleagues, so both at Western University and at the University of Florida. And it takes about 20 minutes to complete. It walks you through a series of questions about that driver. It even has videos that you can complete, and a lot of research has gone into this tool. It wasn't specifically designed for people living with dementia, but it was specifically designed for older adults in general, and it might be a starting point to complete that and know. One of the great things about the FTDS is that after answering the questions, the FTDS is going to classify that driver as a at-risk driver, a routine driver, or an accomplished driver. And based on that classification, it will give you resources and recommendations. It will actually say, we would recommend that you go see the memory clinic or an occupational therapist for a driving assessment. And you can print out that report and bring it to the healthcare professional and say, I completed this online tool and these were the results. And that may give information to the practitioners as well to know how to support you better. The next one is the Driving and Dementia Toolkit. So it is also available online. You can just search it in any browser and you will see it. It has 3 editions now. It has been an initiative developed by a lot of researchers. And one of the things that I really like, it has a healthcare professional version and then a version for individuals living with dementia and their loved ones. And it has checklists. It will ask you specific questions about the things that you're feeling or that you're concerned about regarding your driving, and you can actually complete the checklist, and it will walk you through a decision tree. So it would actually say, if you said yes to this, then here's where we are in the decision tree, and it will tell you whether you need to be looking for more supports. So that's something that you can access, is completely free, and it's available online. And then the third one is the Dementia and Driving Resource Center from the Alzheimer's Association in the US. And one thing that I really like about this is that they have this resource right here, which is around supportive conversations. And so they have a series of videos where they have different loved ones and people living with dementia talking about some of the things that are concerns to them and how to address those concerns in a way that is positive and supportive. So if you're struggling with how to have this conversation with your physician or your healthcare practitioner, or even you as a caregiver are struggling to how to have this conversation with your loved one, you will find very helpful resources here. We also need a driving retirement plan, and Joan talked about this. But unfortunately, the research has shown us that current experiences of driving cessation are often negative for people. So there was a recent qualitative study that was published where they interviewed a number of people living with dementia who had been required to give their keys. And unfortunately, they felt that no one had adequately prepared them for this step. and that it was quite intrusive, and they were not ready. They had not put in place any alternative transportation options. And so it was not a good experience, and unfortunately, that has been consistent throughout the research, which means together, as a society, we need to do a better job in making sure that we understand that driving retirement is coming, most likely, for all of us. Like, we also know from the research that currently we are outliving our driving safety between 7 and 10 years, meaning we are driving 7 to 10 years more than we should, all of us, as a general population. And that means that if driving retirement is likely going to happen to all of us, we should prepare for it. We should prepare it not just for people living with dementia, but for all of us. So just to encourage you, there's a lot of researchers now that are working on how do we prepare for driving retirement? How do we embed this in our current community structures, in our current governmental and legislation structures, and how do we make sure that there's adequate supports? And the next thing is to do that, to have a retirement plan. We need alternative transportation and community mobility. And here I have to say, and I think we would agree, that we haven't necessarily done a very good job at making those things available and accessible to all of us. So that is something that I think all of us together need to work on. But these are some of the resources that are currently available in the province. And some of you may already know this, but just in case, we obviously have public transportation. Unfortunately, there's a lot of advocacy that we need to continue to do. There are rural communities in the province that do not have access to public transportation, nor even in the city. Sometimes it's not easy to access public transportation. In the meanwhile, while we do this important efforts of community mobility, there are other services, like the Canadian Red Cross has transportation services in certain places in Ontario, where they will drive people to appointments or meetings. There's senior care drivers is available even here in London. There's an online application that you can fill out, and they will drive you to different places. Transcare Transportation Services is the same, and they even have a grocery delivery program where you can purchase your groceries and they'll deliver them to you. And then Meals on Wheels, which I think is perhaps the resource that we're most familiar with because it has been fairly stable and a really good resource for a lot of people. In the slides that are going to be available online, I have provided this website address, and that is a very good resource, I think, that the Healthline has put together. So they have every alternative transportation option that is available with information about costs, phone numbers, how do you book them, how long does it take to book them. So if that's something that is interesting to you or important to you, I encourage you to access it because it has very good information. So then finally, 3 things to look forward to. So this is very exciting. The first one is some of you may be familiar with CanDrive. CanDrive is an initiative of different researchers and stakeholders that was funded by the Canadian Institutes of Health Research. It is unfortunately coming to an end, but a lot of research has resulted of it. And as they share their results, we're going to have a lot of information to work with in understanding how to support individuals better. But one of the things I really like about CanDrive is they've engaged different stakeholders, including the ministry, in some initial early-on conversations about initiatives such as degraduated licensing. So if you remember, when you started driving, you had to go through graduated licensing, meaning you had your G1, then your G2, then your G. And that meant you could drive. Some of you are being like, do not remind me of that. That was horrible. Oh, you didn't go through that. Okay. Well, now, the novice drivers, they have to go through different stages of graduated licensing, which means that at different stages, they can drive, but they have some restrictions. So if you're a G1 driver, you can only drive with a co-pilot who is fully licensed driver, for example. And there's a 0 tolerance on alcohol on G1 drivers. If you're a G2 driver, then you can drive, but you have restrictions on the number of passengers that you can take and the time of day in which you can drive. So actually like a lot of states in the US have degraduated licensing programs for individuals living with different diagnoses, and some of the provinces in Canada as well. So what that means is that you would keep your license, but that license would come with a restriction, like you cannot drive at nights. And so you're fully licensed, you just have that restriction on your license. So it's basically building into the regulations some of the things that our drivers are already doing, self-restricting their driving. But it makes it so that the whole system is more supportive of that. So that is in very early conversations, but it's a very promising initiative that we can all look forward to. The next one is advanced driving assistance systems. And that sounds complicated, but it isn't. It's those annoying things that probably beep if you have a newer vehicle, some of those things that start beeping at you when you're going to make a lane change. But some of those things are very promising. So these are sensors that are being built into our vehicles to make us more aware or to help us make decisions or even to automate the driving tasks. So they will take over when you're making a lane change, or they will take over if you're about to have a collision with the vehicle in front of you. They will actually brake for you. And some of research teams here in Canada and abroad are actually working to identify which of these systems are helpful for people living with dementia. Are they safe? And if not, what needs to change in their design to make them supportive of people living with dementia? So we have that to look forward to. And then finally, this one right here, which is autonomous vehicles or driverless cars. So this is a picture of the Central Power and Light Company, 1956. So even back then, we were dreaming of the day where we wouldn't have to stand in traffic and be so bored as like in the wheel. But driverless vehicles are a reality. The technology is there. They're being tested. In Ontario, we have actually a great opportunity because we are the first and only province of Canada that has approved testing of autonomous vehicles in the roads, which means we are going to be the ones setting and leading in the country in regards of how do we do this in a way that is safe. The General Motors, for those of you who think, oh, that's not going to happen anytime soon, the General Motors has already announced that in 2019, they're going to be setting up their first small fleets of public transportation that are going to be completely autonomous vehicles to start getting users' feedback and just getting that into the system. So this is something that we have to look forward to. There are many challenges, and many of us are involved in research studies that are precisely making sure that people living with different diagnoses have a voice and that they're seated at the table and that they're saying, these are the things we need, these are the supports we need, and this is how we need this to be implemented and designed, because that's really important. But hopefully that is also something that we could look forward to. So I hope this gave you some resources, and I would look forward to answering any questions.